Hi, welcome to HIM 5106 Module 12. We will talk about the future of population health and global population health. Our learning objectives: to understand how building and using informatics systems can promote and improve the health of populations, to understand how to identify and follow good data principles using data to understand and manage the health of populations, and to understand how to identify and use business intelligence tools for data reporting, visualization, and information discovery to manage the health of patient populations. The future of population health. Analysts now predict a 25% increase in the technology market for population health between 2019 and 2024. Medical doctors and other clinical advocates are vocal about claims made from consumer apps that are not validated. One example would be popular blood pressure apps. Some of these have been tested and can be wrong up to 80% of the time, but these apps are currently only regulated for safety, not for accuracy. When we talk about being regulated for safety, it's more about, is the app safe in terms of it won't cause harm to the patients, and a mobile app is just a piece of software on a mobile device, so it's not like a device that could actually harm a patient physically with the actual software. But if high blood pressure is a silent killer and the app is not correctly giving information showing that the patient has high blood pressure, then it actually is causing harm to the patient, and it is not covered under the current regulatory compliance. Data is abundant. Models such as the IHMI from the American Medical Association and United Health Group are being developed. Will another common data model be the answer? What about the people side? What are we doing to look at removing roadblocks such as personal agendas, job security, career paths, fighting for research funding? Is everyone finally on board now about the social determinants of health? The American Medical Association and United Health Group are working together to create new ICD-10 codes, and this will include many of the social determinants of health beyond the current Z codes for things like food insecurity and housing. CMS, the Centers for Medicare and Medicaid Services, they are encouraging providers to address the social determinants of health through data-driven efforts and new resources. The agency recognizes the critical role of non-clinical factors such as food and housing security, loneliness, especially in our older population and in our younger population, and educational attainment in determining a patient's capacity to access care and adhere to treatments. CMS is offering a deeper look into Medicare Advantage populations and the significantly different experiences of white patients versus those in other racial and ethnic groups. Trends for 2019 and beyond. According to David Nash, a population health expert here in Philadelphia, the consumer will be where it's at for population health in 2019. Whatever business model empowers the consumer, wherever she is, including at home, will spell success. Home health care, telehealth, and the use of wearables are among the trends to watch in the coming year. The growth of the current Medicare Advantage and Managed Medicaid programs, these are two programs that are currently working. Precision medicine and population health need to be linked. Precision medicine, while looking at individuals, and population health, while looking at populations, need to be considered together. Continued deal making. mergers and acquisitions, payers merging or acquiring pharmacy benefit management companies are some examples. The partnership with Amazon and other financial organizations are another example. Continued health delivery system consolidation. We've seen many major health systems move from having 1 or 2 hospitals to acquiring 10, 15, or 20 hospitals for larger health systems. Pharmaceutical industry disruption, although without controlling the price. Regardless of what side you are on politically, limiting the price of pharmaceutical products just to limit the price is not the answer. There needs to be true disruption in the pharmaceutical industry that will in turn lower the price for products for consumers. Workforce development, educating and training our current and future healthcare and health sciences workforce. Continued venture capital spending, and population health technology to finally close the loop between providers and patients. Now let's look at a broader level at global population health. In 2019, we are still talking about the same principles from the Declaration on Primary Health Care from 1978. Challenges for the global public health in the 21st century include reducing inequalities in health, disease prevention, and health promotion, keeping people well and not waiting until they come into our hospitals where they could end up getting infections or even getting sicker. Cooperation between different sectors of society. This also includes different sectors outside of the healthcare system. Community participation, primary healthcare, and international cooperation. And improving quality in all spheres of life and work in most countries has a major role in reforming healthcare systems and providing services. Assignments in Canvas for this module. There are 2 peer-reviewed articles for you to read. One is The Future of Observational Epidemiology, Improving Data and Design to Align with Population Health, and the other is The Global Burden of Musculoskeletal Pain. For activity M12, this is a short document. This is writing a comment response to the epidemiology article. You do not actually need to respond to the authors. You just need to submit your short document into Canvas. First, read the peer-reviewed article and focus on the technical toolbox components of data sources and machine learning. Then explain the differences, in your own words, between predictive and causal. With your new knowledge in population health technology, prepare a response to this article in the form of a professional comment. Be sure to say something positive, also critique the content, speak from your own perspective, be specific, and prioritize and sort your comment response with the most important key point or key points for the authors at the top or the beginning. Then there's also a discussion board for the global burden of musculoskeletal pain. Read the peer-reviewed article and focus on the mismatch between the burden of these pain conditions and appropriate health policy response and planning internationally. From a population health technology perspective, how can you make a cost-effective improvement? Thank you.